And the head, it's the same kind of the style, just their foot position is different. When you have your patient into neutral position, so then you're gonna feel the joint line where the tibia ends, and then slide your finger a little bit like distally. So then you are on the head of the talus, and then the neck more closely at the joint line. But when you have your patient into the plantar flexion, they should relax their foot. They shouldn't use any muscles. And then same thing, you're gonna find the joint line now, and then slide your finger distal a little bit. Then now you are like anterior side of the trochlea. So just their foot position is different. The way you palpate is same. Okay? For the trochlea and then the head. And posterior medial tubercle. So you're gonna find their medial malleolus first, and then you're gonna locate their Achilles tendon. And you're gonna go in between on the posterior part of it. So then you can feel the medial tubercle on the talus here. And the calcaneus, so the calcaneal tuberosity is hold this structure where the Achilles tendon sits, and hold this is the calcaneal tuberosity. And there's a substataculum thalli on the medial side. So from the medial malleolus, you're gonna slide your finger inferiorly, like distally. Then you're gonna hit the substataculum thalli. Below that, it's all mushy and soft tissue. So the end point of the bony structure you could feel from the medial malleolus, that's gonna be the substataculum thalli. And the navicular tuberosity is like this part, right? So bumpy on the medial malleolus and bumpy on the tuberosity of the navicula. So the substataculum thalli is straight inferior from it. So there's a difference. Like I'm on here on the navicular tuberosity, and then this one is the substataculum thalli. And on the lateral surface of the calcaneus, there is a peroneal tubercle. So when you find their lateral malleolus, you're gonna slide your finger inferiorly to find the peroneal tubercle, and inferior from it there is a groove for the peroneus longus tendon, and it goes underneath of the foot and attaches onto the base of the first metatarsal, right? And then so navicular, we already palpate, like there is a tubercle, it's easy to find it, like it's more like a little bit distal but like more anterior side and inferior from the medial malleolus. And once you locate the tubercle, hold this side is one of the body of the navicula. And then the cuboid, we talked about this, it's gonna be easier for you to find the tuberosity from the fifth metatarsal. Usually it's really bumpy for everyone. And once you locate that, you're gonna slide your finger proximally from there, then you are on the cuboid bone here. And cuboid bone is aligned with the first and fifth metatarsal. So this whole area is gonna be the cuboid, the body of the cuboid. And to landmark the cuneiform bone, it's gonna be easier for you to follow along each metatarsal. The first one, wiggle, wiggle, wiggle. And then at some point, you can feel that with trying to move your metacarpal, but you cannot really feel the movement on it. So then you are on the first cuneiform bone. So your finger shouldn't move when you try to wiggle the first metatarsal. And this one should be distal from the navicular tuberosity. So you need to be in between the navicular and then the base of the first metatarsal bone, right? So then you are on the first cuneiform bone or medial cuneiform bone. And the second one is gonna be same. Like you're gonna just try to move along there, second metatarsal. And then you're gonna be somewhere like, okay, this is not moving. And then just to make sure that find where is the navicula, so you're gonna be distal from it, right? If you are already too proximal, then you are on the body of the navicula. And third one is gonna be the same thing. Try to feel it. Right here. And then make sure that you are not that close, then you are on it, right? So 1, 2, 3. I think that's it. And then we missed some of the posterior one, right? Like a PSIS and then